Good morning, everyone. We're still waiting for people to join. We have about 2 minutes before we start. Just as while we're waiting for others to join, please go ahead and check your video and audio. I would ask if you're not speaking to please put your mic on mute. You can see that in the lower left portion of your screen. Just click the mute button. And then if you are comfortable, please start your video so that we can all see your faces. Thank you so much to those of you who are joining who are medical professionals for wearing your white coats. I think this sends a really strong visual that the medical community is standing in solidarity in support of reproductive rights. So we'll get started in just about another minute. Thanks so much for joining. Okay, thank you so much, everyone, for joining our conference call today, marking the second anniversary of Tennessee's devastating abortion ban. We at Protect My Care and the physicians and healthcare advocates and healthcare professionals who have been advocating for the overturn of this ban have been working on this for 2 years. And what you see today is the medical professional community and healthcare advocates coming together to stand in solidarity around supporting reproductive rights and reproductive freedom. So we're ready to get started. And Dr. Bono, the mic is yours.
If I could, can we make sure that all the doctors in attendance have the presenter Zoom link? I think we need to give that to Carolyn. So, thank you for allowing us that moment to get tech situated. Good afternoon. I'm Dr. Amy Gordon Bono. I'm a primary care physician in Middle Tennessee. I'm a mom and I'm a native Tennessean. 2 years ago, Tennessee's extreme abortion ban was triggered into effect as a result of the Supreme Court's Dobbs decision, reversing nearly half a century of legal precedent and established by Roe versus Wade. Over the past 2 years in Tennessee, we have seen our legislators repeatedly attack our freedoms and the bodily autonomy of patients. Our General Assembly continues to craft legislation making physicians and now even some non-physician citizens possible healthcare criminals. Here in Tennessee and throughout the country, we are seeing women and families suffer as a result of the extreme partisan agendas of radical special interest groups and their careless politician partners, creating dangerous laws litigated in courts full of activist judges. Sadly, Tennessee politicians continue to make laws that are out of step with the desires of the majority of Tennesseans. Most recently, these extreme politicians passed so-called abortion trafficking legislation that would make grandparents and trusted adults criminals when helping a child experiencing a health crisis of pregnancy. Dr. Jill Abremski, who testified during legislative session, will speak about the harm of this legislation again today. In the post-Roe era, abortion is not legal in many states throughout America, and that is wrong and that is dangerous. Pregnancy outcomes should never be criminal. And when a medical procedure that has a therapeutic, life-saving indication becomes criminal, we are on a slippery slope in medicine and in our society. No family is safe with laws like ours on the books. Laws like ours only worsen healthcare outcomes and healthcare access for all of us. And Dr. Carolyn Thompson will tell us more about this issue. And Dr. Heather Mounty will share her practice experiences that led her to file a lawsuit against her home state of Tennessee. We are also fortunate to be joined by brave patients, Allie Phillips, who will share her story of suffering under our inhumane abortion regulations, and Catherine Vaughn, who will share her healthcare journey during infertility procedures. Please recall that our Tennessee General Assembly and the U.S. Senate recently voted against protections for IVF and contraception just a few months ago. Catherine and so many other families are worried about their families' futures in this new harsh legal landscape after the Dobbs decision. We thank you for joining us today and sharing in the belief that our patients and all Tennesseans deserve better laws, better health care, and better elected leaders. Dr. Heather Mounty, please start us off and tell us more about your practice experiences over the last 2 years, which I'm sure are in stark contrast to how you began your career in obstetrics.
Thank you, Amy. My name is Dr. Heather Mounty. I'm a board-certified obstetrician and gynecologist practicing in Nashville, Tennessee. I was born and delivered my children in this state with reproductive rights that have now been stripped away from the patients that I treat. I am here today representing my patients who have been negatively impacted and my colleagues who have been criminally implicated due to the Tennessee's restrictive abortion ban, one of the most restrictive in our nation. On August 25th of 2022, Tennessee's abortion ban became law. Immediately, physicians like me began raising the alarm about this dangerous legislation. According to this law, performing an abortion for any reason, even to save the life of the mother, is a Class C felony punishable by up to 15 years in prison and a fine of up to $10,000. In the almost 2 years since this law went into effect, we have heard countless stories of pregnant patients who have been required to leave Tennessee, leave their friends, their family, and their healthcare providers to receive the healthcare they desperately need. My exam rooms have become a place of further sadness, and during these already traumatizing experiences, only made worse by my inability to provide appropriate care in Tennessee. Today, you will hear from one such patient, Allie Phillips, who, like my patients, has been impacted by this law. These stories of heartbreaking and preventable outcomes are why I joined with my colleague, Dr. Laura Andreessen, and 7 other Tennessee patients in a lawsuit with the state of Tennessee. This law has put the government in charge of deciding which healthcare options are available to my patients, setting a dangerous precedent that violates the sacred physician-patient relationship. And because it includes no exceptions for rape, incest, or fetal anomaly, it forces healthcare providers to balance appropriate medical care with the risk of criminal persecution. It has left me anguished and isolated as an obstetrician and gynecologist. During the 2023 session, the legislature created a medical condition exception, which creates an exception to the ban if the physician determines, using reasonable medical judgment, end quote, that abortion is necessary to, quote, prevent the death of the pregnant woman or to prevent the serious risk of substantial and irreversible impairment of a major bodily function of the pregnant woman, end quote. The lawsuit I'm in argues that the medical condition exception is too narrow and is unclear for physicians like me to provide life-saving care without fear of criminal liability. The lawsuit also seeks to clarify that the exception allows physicians to provide abortion care in cases of fatal diagnosis. Continuing our conversation about reproductive freedom, you will hear from Catherine Vaughn, who has been able to start her family through life-giving options of in vitro fertilization, IVF. Like Catherine, I am concerned that our supermajority Republican legislature in Tennessee blocked a bill to protect IV access and birth control during the 2023 session, saying that such legislation was unnecessary. However, we know from previously leaked audio in a call between Tennessee Republican legislators and anti-abortion lobbyists that these legislators asked about banning or severely limiting access to IVF and certain form of birth control. The fact that these legislators would not vote to protect IVF and access to birth control is very concerning to me, for my patients, for my medical colleagues, and frankly, all Tennesseans. With any legislation that is passed, physicians must be able to use our good faith judgment to provide individualized patient-centered care. Physicians must be able to practice ethical, evidence-based medicine. Physicians must be able to act without hesitation to prevent and treat pregnancy complications. And this is why I will continue to fight for reproductive freedom. Now, I would like to pass the mic to Allie Phillips so she can share her compelling story with us today. Thank you.
Thank you, Dr. Mowney, and thank you everybody for being here. My name is Allie Phillips. I'm a 29-year-old wife and mother. 7 years ago, I had my first child. Her name is Adelie. I spent the first 3 years of her life being a single mom, working 3 jobs and obtaining my bachelor's degree. When Adelie was 4, I married my best friend. I've always wanted a complete family, and so my husband and I agreed to expand our family shortly after we married. We were excited to find out that I was pregnant November of 2022 and began to prepare for the new baby. I was 19 weeks pregnant when I went in for my routine anatomy scan. That day, my doctor informed me they found multiple fetal anomalies. Because of this, they referred me to a high-risk doctor. I arrived at the high-risk doctor and began yet another ultrasound. Little did I know, the next 10 minutes were going to change my life forever. The doctor came in to go over the results, and by this point, we knew we were having a little girl, and we named her Miley Rose. Both of Miley's kidneys, bladder, and stomach did not form correctly and were not functioning. She only had 2 out of 4 working chambers in her heart. She had no amniotic fluid surrounding her. She stopped developing and growing at 15 weeks. There was no sign of lung development. And then the hardest diagnosis of them all was that she had a rare brain defect called semilobar holoprosencephaly. And this occurs when the brain doesn't split completely into the 2 hemispheres, and only about 3% of fetuses can survive to birth. And if they do, they pass within the first year of life. With all of these diagnoses, combined, my husband and I were told that Miley was not compatible with life. Completely broken, I asked, what do we do now? The doctor suggested I had 2 options. One, I could terminate my pregnancy, but due to Tennessee's ban on abortion, I could not legally terminate here. Why? I wasn't sick enough to qualify for the life of the mother exception. My second option was to continue my pregnancy, but risk a miscarriage, stillbirth, or give birth to her to be put into hospice care to pass shortly after. But my doctor said the longer I stayed pregnant, the worse Miley's body would get and the higher risk my health would become. With this information in mind, and knowing I couldn't risk putting my life on the line, we made the very difficult decision to terminate. Instead of grieving what was soon to be my lost child, I had to spend time calling states that allowed midterm abortions, book flights, find hotels, arrange transportation, and secure childcare for Adelie. Ultimately, I found a clinic in New York City that could get me in the following week. Because of the financial burden this trip was going to cost, I had to start a GoFundMe online to pay for the expenses. And without complete strangers on the internet, I wouldn't have been able to get the healthcare I needed. I arrived at a New York City clinic on March 7th last year, and I went back for yet another ultrasound. And it was in that moment I was told my daughter's heart was no longer beating. The doctor informed me that my body hadn't recognized the dead fetus, and I'm at risk of blood clots, infections, or going septic. My abortion, which was supposed to be the next day, was pushed within the hour. I went into surgery alone, and I sat in recovery alone. I grieved the loss of my daughter alone, in a city I've never been in, around doctors I've never met, far away from my husband, my daughter Adelie, my family, and my friends. 2 days later, I flew back home to Tennessee. I had to go back to my life like nothing ever happened. The world was still turning while mine had stopped. I continued to share my trauma online, and it wasn't long after my story went viral, I joined the Center for Reproductive Rights in their lawsuit against Tennessee, and last fall, I announced a campaign to run for the Tennessee State House. My story isn't unique. There are thousands more with stories just like mine. Tennessee's ban caused me an unnecessary trauma that no one should ever have to experience. And as of today, my pregnancy diagnosis is still illegal to treat in Tennessee. Politicians are making laws against something they know absolutely nothing about, and their laws have put countless women's lives at risk, including mine. Now I'd like to turn the mic over to Catherine Vaughn.
Thanks, Allie. Hi, I'm Catherine Vaughn. I'm a public school teacher, a wife, a mother to a precious 3-year-old, and I'm currently expecting a girl in September. Unfortunately, our pathway to building a family was long and difficult due to infertility and recurrent pregnancy loss. I'm here today to represent the thousands of Tennesseans suffering with infertility. No one prepares you for infertility, and I was just in my 20s when I was diagnosed with unexplainable infertility. This was incredibly difficult for someone that has dedicated their life to serving and teaching the children of Tennessee. Over the next decade, my combat veteran husband and I tried various medications to grow our family, but were plagued with negative pregnancy tests and recurrent pregnancy loss. I know firsthand that not all positive pregnancy tests lead to a healthy newborn in your arms. The Tennessee Human Life Protection Act has put family building in jeopardy for so many Tennesseans and has put women's lives like mine and Allie's in jeopardy too. The Tennessee total abortion ban has complicated access to care for Tennessee women experiencing pregnancy loss, which is common with infertility, and has the possibility of far-reaching consequences for those of us using reproductive medicine such as IVF to grow our families. In 2021, my husband and I were finally able to have a child of our own thanks to reproductive medicine. We named him Win because he was our greatest win. Becoming parents to Win made us stronger as a family and helped my veteran husband find his purpose and heal after his experiencing serving our country at war. We want everyone that chooses to become parents to have access to the reproductive medicine they need to start their families. When Alabama's courts ruled against IVF earlier this year, I felt a wave of panic sweep across the infertility community in Tennessee. Many people I know changed their treatments or held back from pursuing fertility treatments altogether. This was devastating. When the Tennessee legislature had a chance to pass legislation specifically protecting IVF, reproductive medicine, and birth control, they chose not to. This again spoke volumes to the infertility community. Under the Tennessee trigger ban, it has also become harder to find maternal care and infertility specialists in our states. I personally fear my doctors leaving Tennessee and have seen their practices shrink in the last 2 years. Infertility treatments are already expensive enough, and now many Tennesseans are traveling out of state to find offices specializing in the care they need. We must work to protect infertility medicine. We need to protect doctors who practice in the field and the patients who turn to reproductive medicine to grow their families. If Tennessee wants to be a family-friendly state, protecting family building through pro-family legislation would be a great start. And with that being said, I would like to introduce Dr. Carolyn Thompson. Thank you.
Thank you so much, Catherine. My name is Dr. Carolyn Thompson. I'm a 7th-generation Tennessean and a board-certified obstetrician gynecologist. I've been practicing here in my home state of Tennessee for almost 30 years. 2 years ago, when the Dobbs decision was handed down and Tennessee's trigger ban went into effect, I could see the handwriting on the wall. Tennessee's abortion ban has been forcing physicians to be faced with unconscionable choices. Number 1, committing a felony and ending their careers, or number 2, committing malpractice and letting their patients suffer and die. This abysmal catch-22 caused me to fear that OBGYN physicians practicing in Tennessee would simply retire, choose to practice elsewhere, or give up the management of pregnant patients altogether. New data that has come out in the past 2 months from the Association of American Medical Colleges Research and Action Institute has shown that the number of doctors seeking OBGYN training in residency in the state of Tennessee has dropped 21% since the state's abortion ban passed. This is almost 300 physicians who will not have the opportunity to care for Tennesseans. Aspiring OBGYNs in medical school are choosing not to do their training in other states that don't have draconian laws that could end their careers before they barely get started. A majority of resident physicians nationwide end up practicing in the states in which they do their residency training. And Tennessee's legislature is almost guaranteeing a crisis in the physician workforce by allowing policy to be dictated by radical fringe groups with no understanding of medical practice. Are these the people they want to turn to for their own care when they have a medical crisis? Are these the people they want to depend upon to care for their family members? I doubt that that's the case. Already more than half of all Tennesseans live in what we call obstetric deserts, meaning that they are more than an hour away from access to care. That's an hour that could mean the difference between life and death for some pregnant patients. This situation will only worsen as the number of trained physicians declines in our state. Every Tennessee citizen should be able to access evidence-based healthcare that they need without medically unnecessary barriers or restrictions. And physicians should be able to offer that care without interference from untrained politicians and without the fear of being criminalized or otherwise punished. Reproductive care and healthcare decisions are complex, they're nuanced, and they should be left up to patients and their trained physicians, not to politicians who are under the sway of radical zealots driving an agenda that is not supported by the majority of citizens in Tennessee. And now I'll turn the microphone over to my colleague, Dr. Jill Obremski.
Thank you, Carolyn. Hello, my name is Dr. Jill Obremski. I'm a board-certified pediatrician who's cared for children and families for over 30 years. I've lived in Nashville 22 years and raised 3 children here, and I'm a proud grandmother of a baby girl. And I am terribly worried about the reproductive health of our youth. Earlier this summer, Governor Bill Lee signed bills that would block adults from helping minors seeking an abortion or receive gender-affirming care without explicit parental consult. Both of these went into effect on July 1st. These bills were passed under the guise of parental rights, creating the false narrative that healthcare providers and other trusted adults in a child's lives are undermining the parent-child relationship. This is simply not true, and so please to listen to what this law really does. The abortion criminalization law creates a new pregnancy-related crime called abortion trafficking. This law seeks adult to legally end a pregnancy. The law uses vague terms as to what assistance means, stating anyone who harbors, coerces, or transports a minor without written certified parental consent. Those convicted of breaking the law would be charged with a Class A misdemeanor, which requires a nearly 1-year prison sentence. Parental involvement in a child's health care decision is what I hope for as a pediatrician and what we all hope for. However, it is an unfortunate truth that we live in a state where a parent may not be present in a child's life and instead are cared for by grandparents or family, friends. Their parents may be incarcerated, lack capacity due to mental health or substance use disorders, or even live in a different country. We also know that youth may just be plain scared to share their health status with their parent. Recall that the perpetrators in sexual assault or sexual coercion of a minor are most often family members or close family friends. Written and certified parental consent may be impossible or simply too burdensome and time-consuming for many families to provide. I think our legislators know that. Our youth should have the right to make their own private medical decisions in consultation, of course, with those they trust and without government intervention. Jules Edwards, a pregnant teen who sought abortion out of state with help from a non-parental adult due to fear that her parents would make her carry her pregnancy, says, quote, "Young people's health decisions should be honored and respected. They should be given the dignity of knowing that they matter," end quote. This bill essentially forces pregnant children to have children, and that is just plain wrong, no matter what your feelings are about life. Thankfully, 2 lawsuits have been filed against the state of Tennessee challenging this law. A hearing to determine whether the court with temporary injunction blocking implementation of the law is scheduled for this Friday, August 30th. Like the other lawsuits we've heard about filed on Tennessee's abortion bans, the plaintiffs argue that the law is vague and violates constitutional rights to free speech and interstate travel. Another bill that has not received attention was signed into Tennessee law in July as well. It requires parental consent for minors to receive routine reproductive health care at our public health clinics across the state. In the name of parental rights, a minor seeking urgent care for sexually transmitted diseases, concern for pregnancy, or to obtain contraception may not receive this care unless the minor has written consent from a parent. Please hear me as someone who oversaw the public health services provided at our rural health departments. Not only are the public health implications of this law tremendous, but the reproductive health of so many of our youth served by our health departments is in jeopardy. Using parental rights to pass laws is new, but know that for decades, some Tennessee politicians have worked to divide us and erode the patient-provider relationship. These repeated attacks on women's and minors' reproductive freedom must stop. We envision a Tennessee where children, from Memphis to Mountain City, from Clarksville to Chattanooga, can thrive, where children can be children in safe, supported, healthy, and loving communities, and where children are free to turn to their trusted adults, family members, and their healthcare provider and other mentors who could assist them in accessing the healthcare they desire and need when they need it. Thank you.
Thank you so much, Dr. Brumsky. That was very well said. Thank you for speaking up for children. And thank you to all of our speakers for sharing their concerns and their stories. After 2 years under our Tennessee abortion ban, patients and families continue to suffer in our state. As long as patients do not have full reproductive rights over our bodies guaranteed, there will be well-funded special interest groups teaming up with extremist legislators to harm women, children, and families, not just here in Tennessee. If you think these special interest groups and their politician partners are done attacking your freedoms, let me tell you, they are not done yet. Mifepristone access for abortion care and miscarriage management is still on their target list, despite the safety and efficacy of this drug being proven over decades. As Dr. Mowney mentioned, we have leaked audio recordings telling us their plans to come after contraception and reproductive health care, possibly even creating IVF restrictions. This relentless attack on healthcare and our freedoms must be stopped. These politicians are doing nothing to make our patients healthier before they encounter pregnancy. They are doing nothing to help improve the maternal and infant mortality we face in our state. As long as the supermajority remains in power, they will continue to pass laws that make more of us healthcare criminals. They will continue to deny women and families the freedoms we deserve to make our own healthcare decisions free from government intrusion. And they will put our children at risk in pursuit of their own agenda. Their laws are extreme, and when things are this extreme, there is no room for grace. Fighting for your healthcare freedoms and your family's future doesn't stop at November's ballot box. Of course, that's a very important milestone, and please go vote. But this journey toward a more perfect union needs you every single step of the way for so many more years to come. So today I am thankful to be surrounded by so many who are standing up and showing up for a fairer, healthier, more prosperous Tennessee that is more humane and more just. And I invite you to join us as we advocate for our families, our freedoms, and our futures. Join us by clicking the link on the chat, protectmycare.org/abortion. Thank you. We do have some time for a few questions from reporters. If you have a question, please raise your hand or enter your question in the Q&A box. Having a hard time seeing the Q&A box. Are there any questions out there? If anyone wants to raise their hand, I suppose.
Dr. Bono, I am not seeing any questions or hands raised. We can Oh, I do see one. Hold on.
Hi, I have a
Emily?
question, I guess, for anyone really on this call, if there's like really practical ways, I guess, to help people who are seeking out an abortion. If there's like organizations or, I mean, beyond just like monetary, I mean, obviously you can contribute to abortion funds, but if there's anything like helping people get out of state, like driving or trying to find like hotels or something for people, I don't know if anyone has any information about that.
Do any of our obstetricians want to take that one first? And in the chat, there is Planned Parenthood continues to be a great ally and a place to start. As best I understand, one of the closest abortion access points to our Middle Tennessee area is in Illinois. So the Choices Clinic, I think it is, in Carbondale, Illinois. I think, can someone confirm that for me?
Yes, and Alamo is
Okay.
the name of another clinic. Those need to be earlier interventions though. And then there's also website Abortion Access that's available. There's a group locally in Tennessee, I believe it's called ACT, that supports local persons in need. Planned Parenthood is a great place to go for advocacy in these. And also the Center for Reproductive Rights, if you're interested in more national, if you're interested to look at what their advocacy looks like across the United States. They have a lot of links to very important women, minority, maternal health care organizations if you're wishing to get involved in that sort of activity as well.
Great, thank you.
And then just to call out some things that are in the chat, abortionfinder.org. Thank you, Dr. Nicole. And there's also an email in the chat. If anyone would like to get involved with advocacy with Planned Parenthood Tennessee and North Mississippi, please email advocacy@pptnm.org.
Before we move on, I think the other thing is to engage in conversations to make abortion a word that is used in our daily language and to destigmatize it, because I believe that it has been creating barriers in our communities for too long. And this care is essential in so many ways. So if you can engage in talking about it, everyone's been touched by abortion care in some aspect. They just may not be talked about. And I think the more we open that communication line, the more likely it is that we can make some real change in the public's opinion and in helping make some legislative momentum to get the safe healthcare that we all deserve in Tennessee.
I think that's another lasting effect of the Dobbs decision. I think that what you may have thought about abortion 3 years ago is certainly not the same at this moment in time. We've certainly felt a lot of ground shifting for many years in American healthcare, and the Dobbs decision was certainly an earthquake for the health of women and families. And from that disaster, we really need to fight for better and more than we have ever had before.
And I think the point that Dr. Mounty makes is an excellent one. Statistics show that 1 in 3 women in the United States have had an abortion. So it is almost guaranteed that there is someone you know who has received this health care. it is critical. It is life-saving, and it should definitely be destigmatized.
If I could, Dr. Bono, just a mention on a bit of a different approach to this is that healthcare decisions need to remain between the patient, the provider, and those other who they trust in their lives. So an overarching issue that we're seeing is the government being in that clinic room where they don't belong, and honoring an individual's personal agency to determine their own actions towards health and well-being.
And I want to say one thing as a patient before we close out. Sharing your personal medical experience isn't a normal thing that people do, especially sharing it in such a public way, to where you're literally on the news and in newspapers and in webinars talking about it. And so, as a patient, if you see other patients sharing their story, know it took them so much courage and bravery and heart to have to step out of their comfort zone and share something so personal and help uplift those stories. Because the more we share our stories, the more normalized it is. Because right now it's all, oh, this is like maybe 1% of women, but it's not. These happen every single day, and women are being denied healthcare day after day, especially here in Tennessee. So when you see a story, share it. Share it, tell somebody about it, help uplift that patient and their experience, because it is a very real and raw experience to have to go through. And it takes a lot to be public about it. So just keep that in mind.
And to read out something in the chat about sharing stories, Rutherford County has a wonderful storytelling event in July where, had a wonderful storytelling event in July where we let community members share their personal stories as a way to erase the stigma surrounding abortion, foster community, and spread awareness. So making more opportunities like that available is a great idea, so that we can all realize just how interconnected we all are and how this issue does touch so many more lives than we really do appreciate. So as we start to close out, any other questions, any other comments that we need to elevate at this moment in time?
I'd like to make one comment. I'm Dr. Michael DeRoche. I've been here.
Hi, Dr. DeRoche. Hello.
Dr. Bono, how are you?
Good to
been
see
here
you.
practicing in town for about 20 years. I'm a high-risk obstetrician. And I think one of the things that the pro-life groups don't quite understand when they kind of term abortion as such a negative thing, a lot of these, quote, abortions are indicated deliveries. And I think that's a very different term that has a very different connotation. A lot of these women are needing to be delivered, and it isn't a question of a choice that they want to be delivered. It's for their own safety. And so I think it's very important for us to frame this as well as indicated deliveries.
Yeah. Sadly, I don't know that politicians will understand the difference, but I'm glad you do. And thank you so much for all the physicians joining us today. Want to say thanks for your time, and please remember, go vote and keep marching toward a better, more perfect union. All right. Thanks, guys.